Syphilis is caused by Treponema pallidum र सिफिलिसको चाहिँ प्राइमेरी सिफिलिस, सेकेन्डरी सिफिलिस र टर्सरी सिफिलिस भनेर यसको क्लिनिकल म्यानिफेस्टेसन हुन्छ। प्राइमेरी सिफिलिसमा मोस्टली सफ्ट स्याङ्कर देखिन्छ हैन। सो स्याङ्कर भनेको इट इज द लिजन अफ द प्राइमेरी सिफिलिस र स्याङ्कर अपियर्स एट द साइट अफ इनोकुलेसन र 3 to 90 days आफ्टर द कन्ट्याक्ट विथ द microorganism the chancre appears र usually solitary हुन्छ र common site for chancre is in the genitalia, so penile chancre in males and vulva or cervix in female. So chancre भनेको this is the primary chancre which has appeared in the lip region. So the primary lesion is elevated ulcerated nodule with local induration, and the lip lesion is brownish with crusted appearance which mimics the pyogenic granuloma. So the lesion is elevated ulcerated nodule र soft chancre पनि बन्छ. So this primary lesion in the oral cavity, it appears in lip, tongue, palate and gingiva. So regional lymphadenitis can also occur in the primary syphilis, which is the intraoral chancre is ulcerated and covered with a grayish white membrane and which is painful. So regional lymphadenitis भनेको चाहिँ hyperemic and purulent lymph node which is caused when the infection from the primary foci spreads to the lymph node. Lymph node मा गइसकेपछि it causes inflammation of the lymph node which is lymphadenitis. र यो क्रममा चाहिँ this can occur in intraoral chancre. So microscopic features, we can find superficial ulcer and intense inflammatory infiltration, plasma cells, and chancre heals spontaneously in 3 to 2 weeks. 3 weeks to 2 months, and microorganism can also be found. So the secondary syphilis, which is also known as metastatic stage, it occurs 6 months after infection. And in secondary syphilis we can find diffuse eruption of skin and mucous membrane. Primary syphilis मा चाहिँ soft chancre भएको थियो भने secondary syphilis मा condylomata lata form हुन्छ, which are the eruption of the skin and mucous membrane. Skin lesion मा चाहिँ macules or papules or rashes देखिन्छ हैन. So such type of rashes है, skin rash हरु, यस्तो skin rash हरु चाहिँ देखिन्छ secondary syphilis को skin lesion मा. And oral lesion मा चाहिँ mucous patch with usually multiple irregular linear painless great white plaque which is also known as snail track ulcer. भनेको एउटा यस्तो ulcer जसले चाहिँ snail को track लाई resemble गर्छ, and these are multiple irregular linear whitish or grayish plaque हैन, जस्तो यसमा देखाए जस्तो. So this one, these are the mucous patches on the palate which resemble the snail's tract, also known as snail's tract ulcer. And these mucous patches are highly infectious and serological test is also positive. र secondary syphilis मा अर्को एउटा लुइस मलिग्ना पनि देखिन सक्छ, which is the severe form of secondary syphilis. र यो मोस्टली चाहिँ इम्युन कम्प्रोमाइज्ड पेशेन्ट्सहरू जस्तो एड्स भएको मान्छेहरूलाई देखिन्छ. यसमा के हुन्छ भन्दाखेरि नेक्रोटिक अल्सरेसन इन्भल्भिङ फेस एन्ड स्काल्प अलङ विथ फिभर, हेडेक एन्ड मसल पेन. र यो भनेको कस्तो हो भन्दाखेरि यस्तो नेक्रोटिक लिजन देखिन्छ के. So this type of necrotic lesion on the face and scalp and the overall body can be found in immune compromised state, and this is the severe form of secondary syphilis. The tertiary syphilis, which is also known as late syphilis, tertiary syphilis मा चाहिँ different systems are involved हुन्छ, जस्तो CNS, CVS हैन. अनि त्यसपछि this is the non-infectious stage of syphilis. र यसमा चाहिँ classic lesion of tertiary syphilis is gamma. So what is gamma? Gamma is a granulomatous foci with central necrosis. भनेको this type of lesion, central necrosis, necrotic granulomatous foci होइन. So this is the result of hypersensitivity reaction between host and Treponema pallidum. र मोस्टली चाहिँ स्किन म्युकस मेम्ब्रेनमा देखिन्छ, लिभरमा पनि देखिन्छ, टेस्टिस एन्ड बोनमा पनि देखिन्छ र इन्ट्रा ओरल्ली चाहिँ मोस्टली टङ एन्ड प्यालेटमा देखिन्छ. कस्तो लिजन हुन्छ भन्दाखेरि फर्म नोडुलर लिजन जुन अल्सरेट पनि हुनसक्छ टु फर्म डिप पेनलेस अल्सर फलोज द एन्टिबायोटिक थेरापी एन्ड दिस रियाक्सन इज नन एज हर्क्सहाइमर रियाक्सन. हर्क्सहाइमर रियाक्सन भनेको यस्तो रियाक्सन हो जुन चाहिँ एन्टिबायोटिक थेरापी पछि देखिन्छ, जसमा चाहिँ टङ एन्ड प्यालेटमा चाहिँ यस्तो फर्म नोडुलर मास देखिन्छ होइन. सो क्युमाटिस लिजन that appears in tongue and palate after antibiotic therapy is Herxheimer reaction.